I'm Jeff Yalden. You blame it on the Don't blame it on the mirror.
Hey, my friends, Jeff Yalden here. So to all the teachers, school personnel, coaches, parents, teenagers, this message is for you. One of the things that I keep hearing about is that we're not mental health professionals. We're not qualified to talk to kids that are in distress or a crisis or need someone. I think that is baloney, and let me tell you why. You are the first people to recognize that something might not be right. And in something not being right, those are red flags that you're able to recognize right away. So you intervening is the most important thing. At that moment, what you say, what you do, how you respond is what is going to be saving a life. What I'd like to do is give you permission to say, hey, you know what? I can engage in this conversation and find out if something's not right, and I can do something because we need you. Okay, so in educating everybody about teen suicide, it's important that we also educate all of the adults in the community that work with students, teens, young people. And it's important to recognize the pre-suicidal and suicidal behaviors and to know how to respond appropriately to the situation that is right in front of you, right there, right now. So, to any adult who works with youth, I need you to be well aware of warning signs associated with suicide. Well, I shouldn't say I need you to, but suicide is something we're starting to talk about in schools. And I want to encourage you to know as much as you can, because teen suicide today is very different than it was 10 years ago. So you recognizing some of these signs right away, I guarantee you're saving lives. And we teach young people first, the subject area is second. So this message is for everybody, whether you're teachers, school personnel, counselors, parents, coaches, teens. Listen, I think another thing that we should be trained in is active listening skills, because again, you're on the front lines of being able to intervene and hear the different cries for help. And I'll tell you, they say 90% of the time before a suicide, within that 2 weeks, there were signs, there were cries, but if you don't know what to look for, how do you know that there were signs? Teachers, coaches, counselors, students, you're the ones that find out first. And then reporting it to the proper channels, the at-risk person has a greater chance of getting the help that they need before a forever decision is made. And I want to make sure that is out there. Also, I think a school should have outside resources available for all students and families who may be considering suicide. Knowledge about the various resources demonstrates that you're genuinely concerned as a teacher or counselor for the students and their well-being, but it also offers the students a sense of hope in facing life challenges. I think you should also not just have it out there in the hands of all your staff, but it should be on your website too, so parents can get to it. Teachers, know in advance. I think all schools should do this at the beginning of the year. Make sure it's updated. What is your school policy and procedures about responding to a suicidal threat, or even what if a suicide happens on campus during the day? What do? Check with the counselors, your school psychiatrist, your school psychologist. Check with the outside community about, do they have any information? I'm telling you something, having this available, this knowledge is not only going to help students and save lives, but it'll possibly avoid some lawsuits. So let's get into this. Warning signs. Everybody should be aware of possible warning signs of suicide. And basically, it's pretty simple. You have different types of clues, behavioral clues, any sudden or unexpected changes in behavior or personality, a situation could be a clue. A student is dealing with a move, the loss of a relationship, being rejected, feeling unwanted, having gotten into an argument. And there's also verbal clues that are both direct verbal clues and indirect verbal clues. Other factors I want you to consider. Gender. Men commit suicide successfully 4.5 times more often than women. However, women attempt suicide 2 to 4 times more than men. Let me say that again. Men complete the act, but women attempt it 2 to 4 times more. Also, not just the gender, but your ethnicity. African Americans, Hispanic Americans, and Asian Americans have lower rates than white Americans. Native Americans as well have a rate 1.6 to 4.2 times the national average. Sexual orientation. Homosexual teens are 3 times more likely to attempt suicide than heterosexual teens. Other things to consider: a previous suicide attempt. Well, that's something that of all completed suicides, 10 to 40% have previously made an attempt in the past. And so here's some ways that you can intervene. Know the escalation process for your school. Be prepared to drop everything to take time to deal with the situation. I want you to take every complaint seriously. Whether the student is just having thoughts, they're having feelings, the student expresses seriously, take it serious. Do not self-diagnose the student on your own. Do not attempt to minimize the problem by telling the student everything that they have to live for. Because if you do that, that will only increase feelings of guilt and hopelessness. Stay calm in the situation. Be supportive. Be non-judgmental. Don't try and fix it. Listen actively and encourage self-disclosure. It is okay to acknowledge that the reality of suicide is a choice, but do not normalize suicide as a choice. Assure the student that he or she is doing the right thing by confiding in you, talking. Do not express discomfort with the situation. It's okay. Your willingness to discuss it is going to show the student that you do not condemn him or her for having such feelings, but by you being present, you're making such a difference, because the child is asking for help, but might not know how to ask for help. But in asking for help, you recognize some signs, you're there. So stay with the student. Never leave the student alone until further action has been taken. Our job is to get the student here and to be able to persuade them to the person that they need to be with. Third-party psychiatric mental health professionals, your school counselor, your administration. You're doing the work, but you're getting the student needs to be. If you're talking to someone on the phone, do not hang up. Get someone else to call for help on another line. You got them on speaker, you're texting someone else. Just recognize that talking about suicide will not plant the idea that suicide is an option. Actually, it's the opposite. Talking about suicide relieves their anxiety, and finally they feel like they can talk. And the more non-judgmental you are, the more supportive and present, and the more you listen, the more they're willing to talk about it. The questions that you ask show that you're paying attention and that you care. So I want to encourage you, ask direct, straightforward questions such as, so are you thinking of suicide? Do you have a plan? How would that look? Be aware that when you're asking these questions, the student's response is probably going to be no. But I want you to ask questions so that you can assess the lethality of the situation, the seriousness of it. And don't be afraid to continue asking, but ask the questions so that they can respond. And they might say no. Don't you be the one that is trying to decide if they're being honest or not. Just getting them to talk. You could ask something like, so what has happened to make life so difficult? Or what has been keeping you alive so far? I mean, are you thinking about suicide? Do you have a plan? What does that look like? Another question is, you can get into, are you using alcohol or drugs other than medication that's prescribed by a mental health professional? And that's important too, because that is like self-medicating. And if you're on medication from a mental health professional, but you're self-medicating, huffing, vaping, marijuana, drinking, it's going to be a problem. So being present with the student that is not suicidal, but is coming to you with a homework assignment and they're struggling, or their parents, or sports or something, just be present, breathe. Your calmness is going to say a lot to them. So I think that's really important. Another question that I want you to ask is, in their plan, what is their method of wanting to end their life? And is that means available to them? And if the means is available, we need to find a way to remove that as soon as possible. Here's an example. If I'm talking to a young man and he's talking about use a gun, well, the means to the end of his life is the firearm, the gun. If there are guns in the house, I would ask this young man, well, let me ask you this. Are there guns in the house? And do you think you're safe being home with the guns in the house? Because at any moment, you might react to a situation, and could the gun be so available that you'd make an impulsive decision? And I'd see what the young man says there. But if the gun is what he's talking about and there are guns in the house, those are some red flags that we have to address right away. And you stepping up and let's talk about this and let's find out how we can remove it. Okay. Some other things are, what do you think are the odds that if something happens, you might choose to end your life? So don't be afraid to just ask questions that are on your heart in that moment. Listen, I would rather you ask the question in the wrong way than not ask the question at all. So again, you think, well, I'm not a mental health professional. I don't know how. Knowing how is less important than that you do ask the question. I also want you to consider this. They call it the SLAP method. And this is another way of determining the risk of the student's plan. But again, you're not the one that makes that decision, but I want to throw it out there in case you're doing any suicide prevention training and using this video. And by the way, if you are, hey, I'm so glad you are, man. And thank you, because this is a conversation we need to start having more. So the SLAP method, S, specific. How specific are the details of the plan? L, what is the level of lethality of the plan? I mean, is it guns? Is it aspirin? What is the level of the means that this situation can unfold and not be good? Okay. The A, again, the availability. What is the availability for the method that the student has to execute this plan? And the P, proximity. What is the proximity to resources that are available? Now that's always a problem, but the sooner we intervene, the sooner we can get the student help and we can get people around the student. We don't want the student making an impulsive decision based on a situation. A lot of teen suicides could be prevented if we intervene sooner and we engage in this conversation. I want you to also take a positive approach. Help the individual see the temporary nature of the problems that they're dealing with, and that this crisis, it will pass. It will be okay. One of my favorite things is just breathe. And if you can breathe with them and you can be compassionate and empathetic, you're going to do so much. Explain to the individual that suicide is an absolutely permanent action to a situation that they're going through right now that is temporary. I think a lot of young people don't really understand the finality of suicide. However, remember that as a teacher or someone in this position, you're not the trained therapist to be able to save the life. Your more immediate job in the here and the now is just to understand as best you can and be compassionate, empathetic, and lead the individual to the right person in this moment of crisis. Often, a child contemplating suicide is unaware of the different social supports, such as counselors in the community, counselors even in school, family, friends that are available. Mention to the individual that they have family that genuinely cares, and they're there to be a source of help and strength. However, if the individual rejects the idea of family, back away. For young people, the source of pain is usually either a family member or their peer group. And although they might put their hand up about these people you might mention, reiterate the fact that there are people, trusted adults, significant adults, that do care. When you get an idea of what it is that is putting this stress on the individual, you're in a better position to help or to refer for help. So engage in the conversation, find out what triggered this immediate response, and you're going to be able to go further in the conversation. But remember, be patient, be persistent as much as you feel is necessary, but don't turn the individual away or make them feel that you're pushing too hard. Use constructive questions to help separate and define the person's problems and do whatever you can to remove some of their confusion. To help a person understand their situation, it's important to use active listening and respond emphatically. So it sounds like you feel, I'm hearing you say this, and so I want to make sure that I'm understanding what you're saying. So ask the question to make sure that you are right with what they're saying to you. And again, provide reassurance that help is available and these feelings that they're having are treatable and that suicidal feelings are temporary. Another thing, thoughts are thoughts. Like an arm is an arm, a leg is a leg. Thoughts are what they are, they're just thoughts. But by getting them to talk about their feelings, hey man, we all need to be more comfortable sharing our feelings and being supported. So now what you got to do is report the incident to the appropriate school personnel, counselors, school administration. And I'm telling you to do that because I want you to take this monumental pressure burden off your heart There you got to get to the right channel, and these people are going to do the work that needs to be done. The psych eval, get the child to the parents, have the parents make the decision. Again, whatever it looks like for your school, your policies and procedures. Another thing, maybe contracts. Seek out your guidance or school counselor or school psychologist as to what is appropriate. Be aware of the school's policy regarding the contracts. If you do not use a contract, see if the student will verbally agree to promise not to make a forever decision, commit suicide. Getting them to verbally say that is going to help your heart and that burden that you got to live with that night. But also, you're saying, I care and I want you to be here tomorrow. Not just a verbal promise, but maybe you can write something out. Hey, I so-and-so and you so-and-so spent time talking about how you're feeling. You're going to promise me that you will be here tomorrow. Blah, blah, blah. That is a last case scenario. You never want to leave a child or a person alone when you sense red flags and this is a dire situation. So what do you do if you can't get a hold of anybody? You got to find out parents, aunts, uncles. You got the computer at school. Who's their emergency contact? Notify school personnel, administration, counselors. We have to have these numbers. The school resources outside in the community, last resort. Hey, you got to call 911. Do in your heart what you think is right. Because again, I'd rather you do what you think is right and save a life than not do something because, well, you're afraid of taking that step and then so. I've seen it happen. Do not carry this burden alone. Again, I emphasize, take all signs seriously. See something, say something, know something, do something. If the child is in this position, they're asking for help, and continue to let them know they're doing the right thing. Always get the help of a healthcare professional. Don't keep the person's threat a secret, but do respect their privacy. Here's some actions that I want you to avoid. Do not promise anything that cannot be delivered. This is a situation where it is never appropriate to promise confidentiality. Do not ignore or lessen a student's suicidal threat. Try to avoid sounding shocked at a student's suicidal thoughts. Do not stress. Do everything you can to not stress the shock or the embarrassment that the student might be feeling or the pain the suicide may cause their family before you're even certain that is not exactly what the student hopes to accomplish. Don't moralize the situation. Do not argue with a student who may be suicidal. You may not only lose the debate, but you might also lose the person. Don't criticize them. Don't ridicule or infer that the individual is crazy. Another thing, don't be concerned by long periods of silence. Remember what I said earlier, you got to be willing to drop everything to be present. And there are going to be long periods of silence because this is a lot for the student or the individual to be getting out. So allow the student time to think. Don't not ignore your own intuition about a student's behavior or changes in what might be happening. Do not try to handle the situation alone. Do not attempt in-depth counseling. Not your place, not your job, not the right time. Okay. Some additional information regarding a suicide. If a suicide does occur, it's essential that the students be provided with accurate facts about the suicide as soon as possible, especially before it gets out on social media. However, This information should be given to all students simultaneously, and it's necessary to provide sufficient time for discussion in the classes. And also support that's available for the students, and not just the students, but remember, our staff is hurting just as much. Of all the people who complete suicide, again, about 90% do things beforehand that indicate that they needed help. They've either told someone they were thinking about hurting themselves, they left these clues. So again, by familiarizing yourself and getting comfortable understanding teen mental health, you're going to be much more aware. My friends, suicide has increased 300% in the past 30 years. Among children between the ages of 10 and 14, suicide has gone up 112%. And for every completed suicide, there's between 50 and 200 attempts. I think that's more. I'm just going off some statistics here, and statistics aren't even accurate because the parents could say it was accidental, and that's another thing. Before you brief your staff and students, it's kind of important that we know what the parents are saying. They don't have to say it's a suicide. They could say it's accidental. And so whatever they say, it's important that we honor that. Let's control the rumors, control the conversation. Remember, suicidal adolescents are a very diverse group. After something happens, be aware of the ripple effect. You don't necessarily need to know someone that took their lives for this to trigger other people. And research shows that an increase in adolescent suicide follows media coverage of a high-profile suicide. My friends, I'm so glad you're talking about this. I'm Jeff Yalden. My website is jeffyalden.com. And if I can help you in any way, please reach out to me. I love you all. No matter what, remember, love wins. Choose life. Choose you. Choose time. Take care.